All right, Nutrition Hero family, this is Dr. Brad Watts, and you are listening to another podcast episode of Nutrition Hero, the only podcast where we're going to celebrate both the art and the science of functional medicine, clinical nutrition. And today is no different. Today I have a special guest with us. This is Dr. Candice Hall that you see on the screen here. So welcome, Dr. Candice. How are you today?
I'm good. How about yourself?
I'm doing well. Dr. Hall is the principal, the owner-operator of Next Advanced Medicine in Orange County, California. Dr. Hall, how long have you been operating NAM?
A really long time.
A really long time.
So, well, I've been in practice now, I'll just say over 20 years because that just makes me feel old enough. So, long time.
All right. So how long have you been participating in functional medicine as one of your offerings?
Probably I started offering functional medicine in my office probably about 15 years ago, but it was just a small part of my practice.
Mm-hmm.
And I would say for the last 5 or 6 years, it's all I do.
Wow. So as far as types of patients that you like to treat and the people that you like to serve, what is that like? Is it niche specific? Is it whoever walks in the door? What is that like?
Well, that's a good question. It's mostly diabetes and autoimmunity, but anybody who's real sick, that pulls on my heartstrings, and I want to help them. And I know that most of the time these people are not getting the help they need. They're getting put on one drug after another. And so if somebody's sick, then I want to take them. It's just, do I have room? That's always the issue, right?
Gotcha.
Yeah.
Gotcha. So how often are you treating patients yourself these days?
Well, I do the labs. I have practitioners in the office, and then we meet weekly and we discuss the cases, but I go through all the stuff myself to make sure that the protocols are what I want.
All right, so you're keeping your toes wet, is what you're saying. That's good.
I have to. It's the stuff I love. It's every patient's like a jigsaw puzzle, are they not? And I love puzzles, so.
Awesome.
Yeah.
All right.
Yeah.
So in the world of functional medicine, especially in the area of the country that you live in,
Yeah.
what are some of the up and coming things that you're seeing? Like what's next?
Well, I would say autoimmune disease is massively on the rise. I think there's people just running around from doctor to doctor trying to find out what's wrong with them and being told it's nothing and being put on antidepressants. So I see that a lot. One of the new things that it may not be new to families that are suffering with it, but there's a huge rise, what I see in the pediatric population with something called PANDAS and PANS, where we're seeing major depressive disorder. I recently heard in a seminar I went to that the suicide rate amongst males aged 10 to 24, it's the second leading cause of death here in the U.S. And I heard that
Wow.
Girls aged 10 to 14, suicide rate has gone up 200% in 10 years.
Oh my goodness.
Yeah, and it's for families that are struggling with it. It's very, I can't imagine. Just it's gonna be crippling. So yeah, that's definitely on the rise.
So for those of our listeners that don't know what PANDAS is, I'm just going to give them a quick definition, and then if you could, would you be willing to talk a little bit about it? What are the things that are associated with it, that type of thing? Okay.
Sure.
So PANDAS it's an acronym, but what it stands for is Pediatric Autoimmune Disorders Associated with Strep. And is this something that, little kids are they catching it? Are they developing it? Are they just ripe waiting for it and then they come across an infection? What is going on is the question.
So specifically the acronym, the one piece that we missed there was Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Bacteria. So they are getting, it usually starts with symptoms like, I don't want to go to school. They stop wanting to be around their peers as much, or they start getting their feelings hurt very easily. They can cry for long periods of time. when they get a strep infection, their symptoms can massively become worse.
Wow.
There's just, I think, and even not pandas, there's PANS where it doesn't have to be strep. It can be a different bacteria. But what the best way to describe it to a lay person would be to say that these kids they'll get an infection, and maybe one of the parents is a host. I mean, like a colonizer. So there are people who can, for instance, carry streptococcal bacteria and have no symptoms, not know that they're a carrier, and then their kids just keep getting it. And when the body consistently keeps getting a similar infection, they keep getting the same infection, the immune system has a tendency to start looking for areas in the body tissue that are very similar to the bacteria itself. It's called molecular mimicry, which those of us in functional medicine are very similar, very, very familiar with. So, for instance, we know that gluten is almost identical to thyroid tissue, which is why so many people who have thyroid disorders do well when they fully pull gluten out of the diet, right? Well, the streptococcal bacteria is similar to an area of the brain called the basal ganglia. And at some point, let's say the child has a family history of autoimmunity, then they go autoimmune to their own brain. Basal ganglia is areas where we make certain neurotransmitters. The neurotransmitters through the brain can become affected because the antibodies are attacking the actual neurotransmitter. If you're not, let's say the patient is making plenty of dopamine, but the receptor is being attacked, and so they can't actually use it. Well, you're going to have a very depressed child.
Right.
You're going to have maybe even suicidal ideation, and it's, at the end of the day, I'm certain social media has something to do with the level of depression that we're seeing, but we have a level of children on antidepressants that's just unheard of. And at the end of the day, many of these, especially before a child goes through puberty, as they start going through puberty, those hormones can really, one, mess with an autoimmune disease, but two, we all know some of the side effects of these antidepressants they can make things worse, not better.
Right.
So these parents are often just sitting there afraid for the life of their child and wondering what to do. And it's just like what we do. They go to the doctor and the only solution they have are drugs. And when you start talking about putting an 8-year-old child on an antidepressant, it's so scary for these parents,
Man, so are you seeing, is it the acknowledgement of PANDAS that is starting to get larger and larger, or is it like more and more kids that actually have it are like developing it? Like, has it been, or is it something that is just growing?
It's been, but from like one of the doctors that I know he's in Texas, Dr. Brandon Brock. Do you know him?
Yep.
He's in functional neurology, and he sees a lot of these cases, and he says it's an epidemic. So, and I see what's happening with the amount of kids being put on antidepressants. I see what's happening with the level of depression that these kids are going through. And obviously we all know anytime you're going autoimmune, there's a mix of toxins. Well, the level of toxins in California, they've put 87,000 chemicals in California that weren't here 10 years ago. And we know they're causing problems, right? So you've got these toxins. We've got toxins in the cord blood, in the umbilical cord of these infants. We know that there's high levels of certain toxins. So right there, that's a problem for the immune system. We've got a food supply that is riddled not only with chemicals, but lots of sugar that we know causes inflammation. That's bad for the immune system. And then we've got, it's just now becoming it. We've always wondered what EMFs, using cell phones and having Wi-Fi in the house. There's always been some theories that it's not good for us, but now there's a doctor that has really figured out exactly where it's all coming from, and what kind of damage it's doing. In fact, there's a great podcast between Dave Asprey and Dr. Mercola on Bulletproof Radio where he really describes in great detail what these, not only electromagnetic frequencies, but the radiation that comes from the microwaves and things like that, what it's actually doing to our brains and our bodies and how harmful it is. I think when you mix all of these things together, we're starting to see more and more of it.
I agree with you too, because like as a rule of thumb, research is about 15 years behind new technology.
Yep.
And we're getting to that 15-year mark when we talk about, wireless phones and that type of stuff. Like the research is going to start pouring in. The data is just going to keep getting larger and larger. So you're exactly right.
He actually addresses in the podcast about the fact that the information that they are trying to suppress it. I mean, imagine it's a huge business.
Mm-hmm.
So having all of this information out there is going to be hard on the business aspect of it. But we've recently gone through and hardwired all of our computers instead of using Wi-Fi all the time, and we shut it off, not just at night.
Right.
Dr. Mercola likens it to chain smoking. He says, we're going to find out that this is like chain smoking, right? Mm. So people think cigarettes were good for them and they're smoking like crazy. And then suddenly they find out it's causing cancer. And how long did the cigarettes companies say, oh, it doesn't cause cancer?
Right.
So I think that's what we're going to start seeing. That's my opinion.
See, like cell phone with a little label on the back of it, just like a cigarette box.
Yeah. Well, even
like
I understand that the manufacturer's warning says it should be, I believe it's 2 inches from the head. Well, you can't really hear your phone when it's 2 inches from your head. And they're saying that that's not even close to what it should be. So,
wow.
Yeah.
Wow. So I read some research the other day. This just like adds in here. Manufacturers of flat screen televisions, right? They can put a filter on the television so that it doesn't emit that electromagnetic field into the room that it's in. But the filter costs $2, so they don't add it to the manufacturing capacity. And like you think about it, at some point, it's gonna just have to be there. If you have this large electromagnetic force in a room, and your kids are like this all day just watching it, like what do you think is gonna happen? So interesting.
I mean, we're just thinking of kids just sitting in front of their iPads or their computer screens and damage it can create. I'm certainly, I recently, I should have brought it up here, but I recently bought there's a device that will measure how much frequency you're getting, so you can see, you can go through different areas in the room. And my poor son, the level of it wasn't just EMS, it was other types of radiation and things like that coming through his room. And when we measured, we had actually somebody come out and professionally measure the whole house. And he's an electronic engineer and does this for a living. And we were surprised with even the efforts that we are going through, how bad some of the areas of the house were. And I think because people don't feel it,
right.
It's kind of like, I don't know, at least with cigarette smoke, you can be feeling like, well, this doesn't feel good. I don't want to be breathing this. Mm-hmm. But with these, we don't feel it. It reminds me of diabetes. I mean, so many of my diabetic patients, they feel fine. And so they just make choices, like they keep their lifestyle similar to the way it was when they got diabetes. So of course it's moving in the area of getting worse. Diabetes is a degenerative disease, and they don't really think about that. They don't think about the fact that their body's dying inside. And so by the time diabetes shows you, oh, you're actually dying, then that's a little bit late. And so, when it's something you can't feel, and it creates, especially something that makes your life easier, like Wi-Fi and being able to push something in print and all of those things, then certainly I think people I think people have a tendency to not want to believe it. Because they don't want to make the changes. But I do think that's quite naive.
Well, yes. And then being on the fringe of like modern medicine and functional medicine and that whole realm, I'm sure you get to see it because you're confronted with it a lot more often. Speaking of which, can we go back to PANDAS for a couple of moments here?
Yeah.
What what is the way forward for these families that are dealing with something like this? First of all, if they don't even know they have it, how do you get screened for it? How is it a collection of symptoms? What's the way forward look like?
Well, I think first and foremost, getting on and reading some of this, just getting on and reading some of the things with some symptoms. I think too, I'm going to give you my I'm going to give you my opinion about the overall aspect of it and then move through. I think one of the things, like when we treat a patient, say a diabetic patient, and then you have a doctor say, well, you can't reverse diabetes, yet we've been doing it. There's hundreds of patients who've done it. We know it's not true. Yet this person takes that person's opinion as, well, that my doctor said it's not reversible, so it must not be. Well, you feel sorry for the patient because that's just coming from years of training of thinking we put these doctors up on a pedestal, right? But obviously, if
Right.
things were working really well, we would be seeing different outcomes, right? And
Hmm.
so you're dealing with part of it is the stigma of there are a couple colleges that came out with some studies that said that PANDAS wasn't real. I just went to a 4-day seminar on the second day of the seminar was all on PANDAS. It was the whole day was PANDAS. And one of the first doctors, a very well respected, I believe he's a neurologist, Dr. Amen, he got up and said, if someone tells you that PANDAS isn't real, just use 3 words. Do you read? That's what it said. I got a kick out of it. Yeah, there's just a plethora of research. There's something called the Cunningham panel. The Cunningham panel is it's a it's a panel that can kind of test and see if they are starting to make antibodies to their neurotransmitters,
Mm.
and at what level they're at. It can also see if the patient is moving into chronicity. So when you catch PANDAS in the beginning, it's usually starting with some OCD behavior, right? And so, people think of OCD as, as having to keep checking to see if things are turned off or turned on or, that type of behavior. But OCD can be perseverating over certain types of thoughts, maybe saving, kids maybe putting items in boxes around the house. I mean, there are different types of ways that this will manifest itself.
Hmm.
And then often when a child, well, the history we're seeing is that they bring the child to a psychiatrist or something, and because they're trained in just giving these medications,
Hmm.
they're just kind of, there's no real answers. In fact, some parents are told, don't try to find an answer. There's no answer. You just got to get them on these medications.
Right. Like, get rid of all your hope and just do this.
Yeah. And
Mm.
then be worried about I'm not saying I mean, in some of these cases, these medications are saving these kids' lives. So I don't want to poo-poo the medications that there are times that but I think parents know their kids. And when they start looking at how is my child suddenly acting this way? I've known them since they were born and I know how they act. And suddenly things are really changing and I don't like the way they look. And then they go to get help. That seems to be their only recourse. And it's the same thing like with a diabetic patient, or an autoimmune patient. When they come in
Mm-hmm.
and say, I still have symptoms, they're like, well, try this antidepressant. Here's the sleeping medication. And that's where we're at, in the States. And so, the Cunningham, so now I want parents to be aware that yes, this is kind of what you're up against when you're going and trying cognitive behavioral therapy, and all of those things may be
Right.
very effective. But if your child in the midst of all of that also has an autoimmune disease or a brain on fire, well, can you imagine the hope you could have? They start these kids on IVIG, and
Mm.
I'm talking in a couple days. Many of them are like, wow, I mean, you're talking about remission of symptoms in many cases, right?
Right.
Um, and it's a road. I mean, they're not just getting IVIG one time, but it brings down the inflammation in the brain. Treatment is often antibiotics, IVIG. That seems to be what I'm understanding is working the best at this point. Mixed with certainly doing some sort of neurofeedback, CBT, something that is also dealing with the emotional aspect, because we know once that area of the brain, the amygdala and things like that get involved, and someone let's say a child is being bullied and becomes despondent. Let's say he does have PANDAS and they start treating it. You still have the brain's ability to then have someone tells him to shut up or something, and they go into that, and then literally when the brain is damaged in that area, they can't get out. They just, and parents, just in hopes to help their children are saying something like, hey, you need to toughen up, or you need to snap out of it. And they can't. They can't. And on top of it, they're just children, and they're dealing with complex things we didn't have to deal with when we were kids. So I think finding a functional neurologist is one of the most important things to do. I think finding, doing the testing. There's something called the GenoMind that really kind of looks at the genetics of the patient and the neurotransmitters that they make. There's the Cunningham panel, which will look at the antibodies to the brain. There are certain viral and bacterial panels you need to do, certain antibody tests. Many of these kids with PANDAS typically have very high ASO titers because they've had strep, right? And but when you're looking at PANS, which is similar to PANDAS but other bacteria, chlamydia, pneumoniae, and things like that, there's lots of them. Then when the bacteria gets in there and the immune system can't fight it, that's when they can go autoimmune. So I hope I'm explaining it well.
Yeah, absolutely. So have there been any connections with food? Like you had mentioned earlier, the gluten and the thyroid situation. Have there been any connections like that with PANDAS? So when we're talking about basal ganglia and that type of thing.
Well, I do know that gluten affects the brain in a big way. So I know that pulling kids off of gluten is important. But a lot of people pull gluten out of the diet and don't realize that other grains are cross-reactive. So when I had my kids tested, my son is cross-reactive to potatoes and tapioca starch. Well, just about everything gluten-free is made out of those two items.
Right.
So when a kid is cross-reactive, it means they make the same antibody to those foods that they do to gluten. So you really want to pull out all the grains, right? And that is difficult, but certainly worthwhile. I think getting the inflammation down in the brain, certainly healing the gut, and making sure they're not eating foods they make antibodies to are an important part of it. But I would think the antibodies would be specific to the child, whatever they're making. But I do know, Tom O'Brien basically has made it very clear gluten's really not good for anybody. So people are just like, well, if you're not reactive to it. I'm like, well, you are. Gluten's like an SOS pad on the intestinal wall. So it's not good for us. So.
All right. So in light of what you're learning as it comes to like little kids and the neurological aspects that you're going through right now, is that shaping your application for maybe chronic disease like diabetes or autoimmune patients? Is that a component that you're considering, like the neurology aspect with somebody with diabetes?
Well, I think, and I'm sure you're seeing it in your practice as well. I think anybody who's in functional medicine will tell you, you have a sick patient, you're looking for subclinical infections. We know, okay, let me give you something really exciting. So one of the things that I had just learned in this last long seminar I went to, there is a bacteria. So there's 6 or 7 strains of Clostridia bacteria. Clostridium botulinum, which causes botulism, C. diff, Clostridium difficile, which we know causes diarrhea and can be deadly. And then there are other ones, right? There's one called Clostridium sporogenes. What they found is that many autistic kids, carry Clostridium sporogenes in the bowel. And they find that when the intestines are really flared up with this particular bacteria, well, then the behaviors seem to get worse. And then they also started noticing that there was this same bacteria in the bowel of some bipolar patients, patients with schizophrenia, right? Well, it's not very easily, this particular Clostridia is not easily detectable in the feces. So stool tests are essentially missing it. So they've created a test. Apparently there's a toxin secreted by this Clostridia that is found in the urine. And these autistic kids and these other people with mental disorders were having high levels of something called HPHPA. And when you see these high levels, and then they started treating these kids with certain antibiotics, not just children, we were seeing this in even adults with some of these mental disorders, they would get a remission of symptoms. And as soon as they came off the antibiotic, well, then the symptoms would come back. And going further into the research of it, they were talking about the fact that this particular bacteria is a spore. And so they would start pulsing the antibiotic, right? Give it on day 1, then let the spores grow, and then give it on day 3. And they're starting to see full remission of symptoms in some of these people, right? So you and I both know, all of us in functional medicine, we see that these bacteria that live in the body change the microbiome, which then there's no way to change the microbiome and not affect the brain, right? The gut and the brain are fully connected, right? So if you're going to have an unhealthy microbiome, you're going to have an unhealthy brain. Leaky gut equals leaky brain, right? So let's say you're looking at an autoimmune patient. I mean, how often are you finding all this bacteria sitting there? And half the reason you can't get rid of it is because of all the stuff in our environment. We're eating fish. It's full of mercury. There's lead in our environment. I mean, it just rains and how much lead is there in our environment, right? So we now have all these metals. Well, we don't live on the metals, but the bacteria in our body do. They love it.
Correct.
Right? So, and then you talk to these people about getting these toxic metals out of their body and having to do these tests, and they think it's like witchcraft or something, you know? Like, well, my doctor's never talked to me about that.
Right.
I go back to Dr. Amen. Well, do they read? Right.
Do they read?
There.
Exactly.
So you're talking toxins, you're talking unhealthy microbiome, you're talking bacteria, and you can't get on top of it. And then you get inflammation, and then you get disease.
Exactly. The test that you're talking about, the HPHPA residue that you can see in the urine, is done through an organic acid test, and it's not expensive. It's easily accessible.
And it's just urine. You don't have to poke anybody.
Right.
Yeah.
And it can make a huge difference in somebody's life, especially a little kid. So
yes. And then you talk to I talk to certain doctors about it, and they're like, I don't even know what you're talking about. Mm-hmm. And here's where, listen, and there are doctors who do. And so what I would want to say to the public is, hey, there are doctors. Listen, most of us, including me, got into functional medicine because I got so sick and I couldn't find my way out. I could not find my way out. And after a year of methotrexate, which is a chemotherapy drug, I don't know. I did not make me well. I can promise you that. So many of us get into functional medicine because of being sick ourselves and because we love helping people, and you don't want to see someone suffering the way you've suffered. And so there's just this dogma that, I went to my doctor and this medication didn't work, and so they're just sitting there suffering. And somebody said to me one time, functional medicine is typically about 15 years ahead of where Western medicine is. And I would say that part of that is because of all the testing that we know is available, where we can ferret out, what's actually going on and work to fix it.
Right. The other aspect of it, I think, is that with the testing, you can explore. Like, you don't have to have a specific code that the insurance company covers, and be like, this is what we're looking for today. You can explore what's going on with somebody and what does the map look like, the whole map, not just like, what is that? Where does this road take us? You get to see the whole picture. And I think that's phenomenal. Like, if you've been in functional medicine for 15 years, doctor, you've seen the advent of many different styles of functional medicine. And one of the things that I'm interested in, anytime I meet somebody that has a unique spin on what they do or a unique approach, is I got to ask, how do you keep yourself up on all the information? How do you educate yourself?
For me, I'm such a nerd. I can't get enough of it. It drives my whole family crazy. So I literally, I put headphones in and I listen to podcasts. I'm on PubMed all the time. You know, we're looking at different published medical journals. I'm, I, I'm going to seminars all the time trying to keep up with the latest research. And I'm raising a family at the same time, but it's what I was meant to do. It's my passion. So, there's the amount of understanding that we have at this point of chronic degenerative disease
Yeah.
is so much more than it used to be. But it just hasn't, I know it'll eventually make its way into Western med, but, I hope anyway, that's my hope is these
Yeah.
tests that are available. I mean, if I can find out they're available, so can any other doctor. So it's just keeping yourself. And then the other thing I do is I'm constantly testing everyone in my own family. So I just want to make sure that I can keep everybody healthy.
Yeah.
And so, and we have hundreds of patients over the years that have gotten well, and it's through, when you're looking every week, I'm looking at about eight new patients that are considerably different than the patient before them. And
Hmm.
everyone is so unique because they have their own DNA. So when you look at the labs of each patient, isn't it so striking how different they are, but how each of them is expressing their genes. And I deal
Right.
with sick patients, so they're expressing their genes in not so good of a way. And so many people are of the impression, well, if you just carry the gene, you're going to get it. And the
Right.
study of epigenetics has proved clearly that's not the case. You can turn them on and you can turn them off. They can express themselves differently. So just
Right.
teaching the patient how they get their body to do that, that
Yeah.
is the beauty of functional medicine it's really bred out of the HMO system. If you look at kind of the way we started going, when doctors really were getting frustrated with the inability to test, because with when the introduction of HMOs, we went from being able to do 26 different blood tests and over a period of years down to 7. So we were doing a Chem 26 and then we were doing a Chem 7,
Mm.
and all because of money. It was just, there were too many people in the United States. Medicare was running out of money, and we just slowly started changing what testing would be paid for. If you were a doctor, you had to prove the tests you were doing were medically necessary, and so you were
Hmm.
very limited in the tests that you could do. And suddenly you find yourself going into this model that says, well, if these 7 markers are okay, maybe they don't have, maybe they don't have cancer, maybe they don't have diabetes or yet, right? But
Right.
prevention went right out the window.
Mm.
So there were many doctors that were frustrated with that system and said, no, I want to be able to find out what's really wrong with them and help them. And so being able to really ferret out a patient's actual physiological problems and treat those, the cause of disease, that is the bread and butter of functional medicine,
Right. So
different than even integrative medicine, right?
yeah, exactly. So have you journeyed into um, coordination or cooperation with medical physicians, that type of thing, as far as like in-house in your practice?
Well, we have lots of doctors in my practice. So, there's a medical doctor and he's my partner in my practice, Dr. Neil Hirsch. And then we have chiropractors, nutritionists, and we have all kinds of people in the firm.
Okay. So how
Fantastic.
much collaboration are you able to have? You had mentioned that you have meetings with your practitioners. What's that
Yeah.
like, being the person that sits there and organizes all of this?
Well, so to get a job in my clinic, the doctor has to pass some tests. They really have to know what they're doing. So in my opinion, we've got some of the best minds in functional medicine sitting in one room once a week. And we have a long meeting and we will take the cases and we discuss them in a roundtable discussion. And then we're always bringing in, like this week, we'll be talking about all the new testing available for some of the patients that are available that just from the last seminar we were at, and discussing how that's which patients we're going to be using it on. And every single one of those docs will tell you it's the best part of their week. Not that we don't love treating the patient. It's
Right.
just we're all a bunch of nerds, and we
Right.
just want to get in and sink our teeth into the next thing that's going to help the patient.
Gotcha. Cool. So what, just as we wrap up here today, what do you have for like the next generation of functional medicine providers, like the next generation of doctors, nutritionists, whoever they might be? What is something that you, as like somebody that's been in the game for a while, can say to them for like encouragement, or like, hey, functional medicine is like, what is it that you have for them?
I'm not positive I'm understanding your question. You're saying for the next generation of doctors coming in that are doing it, like to keep them motivated to keep learning it, or what do you mean?
Well, like, what would you say to somebody in school right now?
I would say learn as much as you possibly can and don't stop. Just if you've got a passion for it, you can help so many people who are, people have never been so sick. You know, it's not living. It really isn't. You meet these patients, if they really want to help people, there's an awful feeling. If somebody comes in and they're sick and you can't help them, and you're trying everything you can, it's a terrible feeling. You just don't want to be stuck with that. And functional medicine, in my opinion, is the best way to find out what's really wrong with the patient and help them. It's the outcomes are just unmatched. I know that Dr. Hyman, when he was invited to bring functional medicine into the Cleveland Clinic, what was that, only maybe 2 years ago?
Mm-hmm.
And the waiting list to get into that program is over 3,000 patients deep.
Mm-hmm.
And that's because of the outcomes, right? The outcomes are just unmatched. So, I would tell them, jump in with both feet, learn everything you possibly can, and just keep doing it. Keep learning and keep learning and keep learning, because you'll find it happens all the time to me. You'll be sitting there worried about a patient. I will literally wake up sometimes. I don't even realize that I'm dreaming about it because I'm not fully awake. My husband will tell me in the morning about some patient I was talking about in the middle of the night, right? And so you'll go to some seminar and you're like, oh, that's Judy. You know what I mean?
Right.
That's, it'll click like that. Now I know what to do. So you just got to keep going.
That's awesome. So I appreciate your time today, Dr. Hall. And like, I get excited to when I get to sit here and just listen and ask questions and like just shell them out at you. I appreciate that. I love it. So that's great. So thank you so much for your time today. I know that you're busy with practice and a family and stuff to do. And here we are. It's Monday and you took time to hang out with us. I appreciate it.
Oh, yeah. Yeah. I love doing it. Well, thanks for inviting me to do so.
All right. So you be blessed, and thank you for being on the podcast, and we'll talk to you next time.
Take care. Bye-bye.